Hello. I am going to, what we're going to do is we are going to be jumping straight into the blood test analysis walkthrough and tricky trends. So I'm going to be taking you through exactly the process that I do when I do a blood test analysis for a trichotillomania client. So as we go through, I'm going to explain what all the different indicators are on the blood test, but I'm also going to be giving little snippets of what I've seen in all of the blood test results that I've looked at with my trick clients. Okay, so just going to start with the slides here. So just a little bit about me just to get started. So I'm a clinical nutritionist. I have my Bachelor of Health Science in Nutrition and Dietetic Medicine. I finished this back in 2019, but it was during university that I started to look at, I remember doing an assignment on anxiety and depression and which nutrient deficiencies. I know vitamin D came up a bit, which is one that we're going to be looking at. And I'm pretty sure B12 and folate may have come up as well. And when I started researching that assignment, I started to think, I wonder if it's got anything to do with the hair pulling. So by then I'd had it for 20 years, and I just started to look into it. So I've been a hair puller since I was 12. So, but I've been in my own recovery. Basically started researching it halfway through my degree in 2017, but it wasn't until 2020 when I had my second baby that I really started to implement a lot of the strategies and a lot of the things that I'd been reading about. So I've been in my recovery since then. I started sharing about it about a year into my own recovery online, which is Tricky Nutrition, which you would have seen. And through Facebook and Instagram. And then it was a few months after that I started to see some other clients and started getting results for them as well. So, and that's been the last 4 years. I've seen over 150 different blood tests. I've done a lot of courses about interpreting blood test results, not just looking at it, just each individual result, but actually looking at it as a whole. So, and that's definitely developed, and I've seen a lot of things, a lot of sort of trends and similarities with a lot of the trick clients. So, and that's what I'm going to be going over with you today. So we do have a lot to cover. So these are the blood tests that we are going to be looking at today. So we've got a whole bunch here. So we've got electrolytes, we've got liver function, we've got lipid profile. So that's your cholesterol panel. We've got iron studies, so all your iron markers, B12 and folate. We are going to look at the full hematology, which is your red cell and your white blood cells. We're going to be looking at thyroid function and also vitamin D. So we'll get straight into it because there is a lot to cover. So just as a quick health disclaimer, so the information provided in this masterclass is for educational purposes only and does not substitute for professional medical advice. I do advise that you consult a medical professional or health practitioner if seeking specific advice, diagnosis, or treatment. So just as I mentioned before, so these are the blood tests that we need. Often we may just get given, electrolytes, and they may just have sodium and potassium. Sometimes we may get a liver function test and it may only include bilirubin and alkaline phosphatase, which is the ALP that you see there. Often we don't get all of these that I've written on here, but if we want like a full, really good look, it'd be great to get all of these done. Often you might have a couple missing. Again, with iron studies, I love getting those 4 indicators because it really tells me about utilization, absorption. It tells me all of the things that I need to know. Whereas if we just get a ferritin figure, we often, it's not really telling us enough. Of course, I use what I've got. And then, if we don't have enough of those iron studies figures, we'll look at hemoglobin, which would be in your general hematology report, or we'll look at white blood cells and see what's happening there, and the other red blood cell indicators. So we're never just looking at one thing, but this is the full list of what I really like to look at. The one I haven't included on here is fasting blood sugar. That sort of tells me just the snapshot of what you've eaten in the last couple of days. I do like a HbA1c, which gives me a snapshot of your blood sugars over the last few months, so we can see what's happening there. I didn't include it in this presentation. I feel like there's already a lot. There's also other things we can look at. We can look at MTHFR gene variations. We can look at homocysteine. We can look at C-reactive protein, which tells us a lot about, and ESR. It can tell us a lot about inflammation, but we've only got a certain amount of time. And these are really the core ones, and the ones that I've seen, very particular trends in those with trick. So that's why I wanted to include these ones, and these really are a real good baseline to get to that root cause for the hair pulling. So first, I just want to explain how I analyze compared to how a doctor may analyze your test results. So what are doctors missing? So doctors, they're there, and I'm talking about general practitioners or your family doctor. They're there to diagnose a condition and treat those symptoms. So if you've got high blood sugar, they're going to diagnose you with diabetes, and then you are going to, possibly go on metformin. Or if you've got a good doctor, maybe they will prescribe a healthier diet or some exercise, something like that, to try and get your blood sugars down naturally. But yeah, that's basically what doctors are trying to do. So whereas a holistic practitioner, and I've used those terms, because I'm talking about nutritionists, naturopaths, those sort of natural health practitioners, we're trying to work out and treat that root cause. We're trying to work out why. So every single indicator that comes up, we'll go, but why is that like that? Why is that iron low? Why is this happening? Why is it not utilized properly? And that's what I'm trying to work out when it comes to the hair pulling. So looking at all of these indicators and working out, why is this behavior here? Is there a deficiency that's not, producing that right neurotransmitter or that right balance in the gut? So that's what we're really trying. We're just asking why. And then we'll get to another, conclusion, and then it'll be like, but why is that? And you're just trying to really get to the bottom of it. Doctors also don't really understand the reference ranges. They'll look at a reference range and they'll go, okay, that's low. So for instance, they might say low vitamin D, go out and get some more sun or take a supplement. They may see low iron and say, oh, your iron's a little bit low. Yeah, you could take a iron supplement, which I've been told before, and I've even been told, oh, it's not that low, don't worry about it. And I've looked at it and gone, oh, it's considerably low. Or they'll go the opposite, and they might prescribe this massive dose that, doesn't really look at what is the root cause for that iron deficiency. They haven't looked at your B12 and folate and how that helps to utilize the iron. They haven't looked at white blood cells and seen there's possibly an underlying infection that's stopping that absorption of the iron. They haven't looked at the diet to see, is there enough iron-rich foods in the diet? So that's what I like to look at when I'm looking at reference ranges. They often also, doctors, and I don't want to completely slam doctors, it's just the fact that they don't have that training in nutrition, and they don't have that training in, really deciphering blood test results. So they do often ignore abnormal or extreme results. So I've seen it a lot in my clinic, where a client will come to me and they'll say, they'll show me this massive, off the charts, out of their reference ranges. And they're like, oh, that'll just, that'll sort itself out. Or no, that's nothing to be concerned about, when actually it is. And we need to be looking at all of it. And then they also, like I said, don't look at the full picture. So, we might look at one and go, that's a little bit out of range, but that'll probably sort itself out, or we'll just take an iron supplement. But, they're not looking at other indicators in there. So whereas a holistic practitioner will take into account all of your results and look at you as a whole and as an individual, rather than, you know, a doctor who has seen 20 other clients that day or patients that day. And they'll say, I've seen this before, you know, and go, yep, if you just take this, you'll be fine, sort of thing, just by looking at that one indicator. And, you know, just treating that person, it's almost just like that next. And obviously doctors are overrun with patients at the moment. We're living in a very sick society thanks to our food supply and our environment and what we've been doing lately. But that's what we're here to you know, help today, and that's what holistic practitioners are here to help you with. So it's great that you're watching this, and that you're interested in helping out your health and getting it sorted. So I want to make a note about the reference ranges. So reference ranges, you know, and they're the ones you'll see on your lab result, you know, to the right of the result. It'll have this little range, you know, it might have, you know, 60 to 200 nmol per litre. So that's their reference range that they use. That's often called the normal or the standard. I think they are neither normal or standard. Often they'll be maybe just the lab's statistics. So if you do go to different laboratories, you'll notice, you know, I can go to 2 different ones in my state of South Australia, and you might get 2 different reference ranges. Okay. So the different labs do have different ranges. They are based on the unhealthy population. So generally healthy people don't go and get blood tests. So it's the unhealthier, you know, population that are usually getting these blood tests. And that's where these reference ranges are, you know, based on. They're also based on risk of disease. So you're at higher risk of this disease. Remember, you know, just labeling those disorders and diseases, you know, and treating an actual condition, you're at higher risk of that if you have this, rather than looking at what an optimal range might be for that individual person. So I work on the optimal ranges, and we can see a lot of the time, you know, you can notice this trajectory. So you can often see, you know, patterns in someone's blood test results before they even present with symptoms. So obviously most people that come to see me in clinic already have symptoms. But even if I see a lab result and it's something, you know, often you might have 3 or 4 years of results and they're next to each other in the report, you know, you can often see that trajectory. I know I see it a lot with thyroid, which we'll be going through afterwards. But with the thyroid, you know, you might see that TSH just slowly creeping up, or, you know, you might see your B12 level slowly creeping down, you know, as their gut health's getting worse and things aren't absorbing properly, or, you know, their eating, you know, hasn't been as good, or not looking after themselves as well. You can slowly just see that trajectory. If you can see results over a few years. So that's not always possible, but often if someone's been sick for a while, I might have access to, you know, quite a few blood test results, which is really cool to see. But yeah, it's frustrating because it's like, oh, we could have done, you know, it would have been so much easier to deal with 3 years ago or 4 years. I do have one that had a thyroid, and you could see it on the blood test for 8 years. I reckon she was undiagnosed for 8 years, that I think she had been struggling with. And it would have been nicer to deal with it sooner. Doesn't mean it's impossible to obviously reverse and to heal the body, but it can just take a little bit longer. Okay, so that's reference ranges. Now, we're going to start in on the tests. And the first one that I'm going to be covering is electrolytes. So when we think electrolytes, I know a lot of people probably think of like, yeah, Gatorade, and just, you know, it's all of those minerals that we need. So sodium, potassium, chloride, and bicarbonate are the ones we're going to be going through. Mostly it's those top 2 that I concentrate on when it comes to my blood test analysis. So most of the time I'll see low sodium. So a lot of us have been given the message of, you know, reducing salt intake and all of those things over the years, where our body actually needs a certain amount of salt. So if we don't get enough of it, we can become fatigued. When we're stressed, we usually use up a lot more of it. So I usually see low sodium levels. So as I mentioned, it's usually because like a high stress situation, like a chronic stress, and it's leading into that burnout and that adrenal fatigue. So adding a little bit of good salt goes a long way. Now potassium is the second one that I really look at. And when we have low potassium, so that's another trend in the trick clients.